Okay, this is week 5. This one is going to be a little bit weird, and it's going to be more conversation due to the fact that I actually don't have a stuffed animal with legs, and my dog would not allow me to do any of this on him. So work with me. I promise the next time we need a patient with legs, I can make this happen. So I will just be describing and walking you through the process. So our week 5 case was lower back pain. Patient presented with lower back pain going down the leg to the small toe. We believed that it was S1 radiculopathy. So we are going to be inspecting and palpating the lower back. So for the bony palpations, we will be looking for the lumbar spinous processes, the sacral tubercles, iliac crest, and the PSIS. The soft tissue palpation will be the paraspinal muscles, which would be the spinalis, longissimus, and iliocostalis. You need to palpate as a unit and individually for those. Then you are looking for the sciatic nerve, glute max, glute med, hamstrings, biceps femoris, semitendinosus, and semimembranosus, which are all part of the hamstring group, and the anterior abdominal muscles as well. For range of motion, you are looking for active range of motion, which I cannot demonstrate due to my patient. So flexion should be about 25 degrees, extension should be 30, left and right lateral bending should be 25, and left and right rotation should be 30 degrees. So bony palpation, active range of motion, soft tissue. So the orthopedic tests that we'll be doing, I will list all of them first, and then I will talk through each individual one. So the first one is straight leg raise, and then I need to explain buckling sign, braggart, well leg raise, bowstring, and Kemp. So for straight leg raise, you would have the patient supine like this. The examiner would raise, or I will raise, the legs slowly to about 90 degrees or to the point of pain. Positive would be radiating pain or like a posterior thigh pain. What this could indicate is sciatic radiculopathy or possibly tight hamstrings. To differentiate the two, for a positive between 35 to 70 degrees would be possible sciatic radiculopathy. Less or more than 70 would be tight hamstrings. So the next test that I would be doing would be, explaining the buckling sign. So what you would do is the patient again would be supine, and then you would do a straight leg raise on the patient, which is the test that I just explained and performed. Positive for this would be pain in the posterior thigh with sudden knee flexion. So you're looking for the knee to actually like buckle. Excuse me. This can indicate sciatic radiculopathy. And then the next test that we would perform would be braggart sign. Patient again is supine. You would perform a straight leg raise on the patient, which again would be the first test that I described. You would raise the leg to about 5 degrees from the point of pain and sharply dorsiflex the foot. This means that it could be a positive for radiating pain and dull posterior thigh pain. It indicates sciatic radiculopathy. Let's see. Well, bowstring. Okay, bowstring sign. Patient remains supine. You're going to place the patient's leg on their shoulder and first apply pressure to the bicep hamstring muscle. If pain is not elicited, then apply pressure to the biceps and semimembranosus tendons, then to the popliteal fossa. Positive, pain in the lumbar region, hamstring, or posterior thigh pain. This again indicates sciatic radiculopathy or tight hamstrings. The well leg, okay. So the well leg raise test. So a big differentiation between this and the other tests is that you are actually going to be raising the unaffected leg, the good leg. So you're doing a straight leg raise on the good leg to about 75 degrees or until there's pain down the leg. Positive would be pain down the affected leg or decrease in pain down the affected leg. This can indicate medial disc protrusion or lateral disc protrusion. Sorry, excuse me. Let's see. Then the last one, I believe, in terms of tests, would be, I think, would be chem test. I think it's chem test. Yeah, so chem test would be the last one. You would actually display. So chem test, you have the patient seated or standing, but at least in most of my ortho and neuro classes, they recommend you do it seated. With arms crossed in front of the patient's chest, I would stand behind the patient and stabilize on the opposite PSIS. With my other hand, I would reach around the patient and grasp patient's shoulder. I would passively bring shoulder back and obliquely push shoulder down towards the PSIS, towards the opposite PSIS. Positive would be pain usually radicular, recreating existing sciatic pain, or pain can be local. If it is radicular, then it is a possible disc protrusion. If it is local, it's localized pain, which may indicate lumbar spasm or facet capsulitis. Then the last exam, because we want to know the nerve root, we would perform the S1 nerve root evaluation. And testing nerve root. So to test the individual nerve root for S1, the disc level would be L5. The muscle tests that you would do would be foot plantar flexion and eversion, and hip extension. The reflex for this nerve root would be Achilles, and the sensation would be posterior aspect of the leg, lateral aspect of the foot, and lateral aspect of the little toe. Again, I apologize for not having a patient with legs. I hope that my description was adequate enough. And again, this is week 5 case lower back pain. I appreciate it. Thank you.